Hi ladies, welcome back to my channel. Today we're going to talk about the Pap smear test and the findings. If you like this channel and you want more medical content, please share, subscribe, and then let's dive in. First things first, what exactly is a Pap smear and what is it testing? So a Pap smear is a part of routine well-woman exams, and the test is designed to collect cells from the cervix to evaluate for abnormalities. The best result is NILM, which stands for negative for intraepithelial lesions. There are other findings that can also result, such as epithelial cell abnormalities, which we'll discuss, irritants such as infections, and then finally endometrial cells for our fabulous women over the age of 45. Now let's talk about our intraepithelial cell abnormalities. We are looking for precancerous or cancer cells that are often caused by long-term viral changes such as human papillomavirus. We've got squamous cells and we have glandular cells. For our squamous cells, these can be presented in 4 ways. Number 1, you have your atypical squamous cells, which can either be undetermined significance or high-grade probability. Then you have your LSIL, which is low-grade squamous intraepithelial lesions. These usually resolve on their own. Then we have high-grade squamous intraepithelial lesions. These have a high probability of progressing to cancer. And then you have full-blown squamous cell, which is cervical cancer. We also have glandular cells, and these cells usually come from the endocervix or the endometrium, where the menstrual shedding comes from. We've got atypical glandular cells. We've got endocervical adenocarcinoma in situ, and then we have adenocarcinoma. Now let's move on to benign-appearing endometrial cells, also known as BEC. This used to be a test that was noted for women 40 and over, but the age has been increased to 45 to improve the diagnostic accuracy of the test. If you are premenopausal, the finding of BEC is totally normal and is expected from menstrual shedding. However, if you're 45 and older, or if you are postmenopausal, the appearance of endometrial cells, or BEC, will need further evaluation and treatment. Now let's talk about the other findings that your Pap test can pick up. We're talking about irritation, which just needs to be monitored. Sometimes infections will be found, such as trichomonas, bacterial vaginosis, actinomyces. But these tests are not diagnostic of the infection, and if your doctor considers that there's an actual infection going on, there's more specific tests to check for that. Now let's talk about human papillomavirus, which is a crucial part of the Pap smear test. Your test will tell you the specimen type, the specific test performed, and whether it was positive or negative for HPV. There are 2 types that we are mainly concerned with, 16 and 18, as those viral types are responsible for the majority of cervical cancers. A first-time positive test is not really a big deal, but if it's followed by a repeat positive test 12 months later, then that indicates a higher risk for developing cancer. So, in conclusion, if your Pap test is NILM, that's a negative for intraepithelial lesion. But if the test says it's unsatisfactory, then that means that not enough cells were collected by your physician. That can mean that depending on your age and risk factors, they may decide to repeat the test or just test in 12 months. For those who are 30 or over, if HPV is of risk and serious concern, then they will repeat the test. They might recommend genotyping to look at what type of HPV the patient has, and they may test. If it's unsatisfactory for evaluation, then the physician has to take into the patient's age and risk factors to decide the next steps. For women under 25, HPV testing isn't usually recommended, so the recommendation may be to repeat the cytology. Of course, there are special considerations about risk factors and recent infection. If you're 25 and older though, and your HPV test is positive, then you're gonna need a colposcopy. So your test is positive, what next? If you have NILM, but you had an unsatisfactory specimen, then your physician is going to decide whether or not to repeat the test. Usually with minimal risk factors, the test can be repeated in a year. When it comes to genotyping, however, if the patient is 25 and older and they're positive for HPV, they're going to end up getting a colposcopy. For women who are 25 and under, HPV testing isn't usually recommended unless they have some risk factors. In conclusion, These are general guidelines to help guide an understanding and awareness of the Pap test and the importance of HPV testing in certain cases. Of course, these tests are going to be tailored, and the results and further evaluation will be tailored based on your unique situation, which will include your risk factors and your genetic history. If you like this content, please share and subscribe. This helps me grow my channel. I'm here to educate you and to empower you on just basic awareness and understanding. Stick with me, I'll make the medicine make sense. Until next time.